This is TLC to go.
Welcome to the Deep Dive. We're here to look at resources that can really help make your teaching in health sciences even stronger.
That's right. And today, we're digging into something highlighted by our own UTHSC Teaching and Learning Center. A great resource for faculty here.
It really is. So this deep dive, we're focusing on one key area the TLC supports.
And that's competency-based assessment. We're using the TLC's own material, so it's very much grounded in, how we might apply it here.
Okay, great. So maybe just to start, for anyone less familiar, what's the core idea? What is competency-based assessment, according to the TLC?
Well, in a nutshell, the TLC describes it as evaluating students based on their actual competence, what they can really do.
Okay.
It's all about connecting that classroom theory to, actual practice.
Right.
And it really relies on continuous development. So 3 things are key. You need clear definitions of the competencies, then assessments that actually, measure those accurately.
Makes sense.
And finally, effective feedback that really helps the student grow.
So less about just knowing stuff and more about showing they can apply it.
Exactly. Demonstrable skills.
Okay. So why should faculty think about using this approach? What's the big push or the benefit?
That's a really important question. The TLC resource points straight to the needs of today's healthcare system. It's demanding.
It certainly is.
We need graduates who aren't just knowledgeable, but genuinely competent practitioners. And this assessment method aims right at that.
So it aligns with what's needed out there.
Precisely. And an interesting point, which the TLC connects to an article by Lockyer and others from 2017, is that it shifts the focus.
Shifts it how?
From just how much time a student spends learning to what they can actually achieve.
Outcomes over seat time.
Yes. And it often involves using, multiple types of assessments for learning, helping them develop not just assessments of learning at the very end.
Right. Supporting them along the way. Now, you mentioned feedback earlier, and the TLC materials talk a lot about formative assessment and feedback together. What's the story there?
Yeah, they really emphasize that combination, using those ongoing, maybe lower stakes, formative assessments consistently.
The check-ins.
Exactly, the check-ins. And combining that with feedback that's timely and, really targeted, that combo is what truly helps students hit those learning goals.
Okay.
The TLC points to some research like Lee and Azriani's work in 2022 that backs this up strongly.
And it sort of changes the dynamic.
It does. When you weave them together well, the line between learning and assessment starts to get a bit blurry.
In a good way.
In a very good way. It becomes this continuous cycle. Sisterman's noted back in 2020, this helps learners build their skills step by step and move to the next level when they show they're ready.
Guiding the journey, not just measuring the endpoint. I like that.
That's it.
Okay, so let's get practical. The TLC resource offers some specific teaching tips. What's the first one?
Right. So the first tip is about perspective, really.
Yeah.
Thinking about your course. Where does it fit?
Fit within the whole program.
Exactly. Within the whole program or the degree path,
Right.
You need to identify which specific competencies your course is supposed to build.
And at what level?
And crucially, at what level? Are students just getting introduced? Or are they expected to be applying things more deeply by the end of your course?
Okay.
The TLC even suggests maybe using a document that lists the core competencies for your whole discipline, kind of like a map.
A map, yeah,
Yeah.
to make sure everything lines up and you're not repeating things unnecessarily or missing gaps.
Precisely. It helps make the whole student experience feel more connected.
That makes a lot of sense. Okay, tip number 2 then moves to the assessment tools themselves, right? What should we be thinking about there?
Yes. This is where you choose how you're going to assess. The key is using multiple methods, variety.
Not just one type of test.
Definitely not. And those methods need to be directly relevant to the competence you're actually measuring.
So aligned.
Perfectly aligned. And importantly, they need to be developmentally appropriate for where your students are. So maybe you use simulations for clinical skills or perhaps case studies for diagnostic thinking. Whatever fits the competence and the context.
Okay.
Oh, and a really practical point they make. Consider if you can maybe merge assessments sometimes.
Merge them. How so?
Well, can one activity or assignment let you assess multiple competencies efficiently? It saves time, but still gives good info.
Ah, smart. Being efficient without losing quality. I like that. Okay, tip 3 zeroes in on feedback. We know it's important, but what's the specific advice?
The big message here is integration. Feedback isn't an add-on. It needs to be woven into the fabric of the course.
Okay.
And it should come from different sources, not just you, the instructor.
Like who else?
Well, definitely self-assessment. Students reflecting on their own work. Peer feedback can be really valuable too, and maybe even external stakeholders, depending on the situation. But the core idea is planning for it, making it continuous and consistent.
Planned feedback, not just off the cuff.
Exactly. And they strongly recommend using rubrics.
Oh, yes. Clear criteria.
Clear criteria are essential. It makes the feedback transparent, helps students see exactly what they need to work on, gives them concrete next steps.
Definitely. Clear rubrics are huge. Okay. And the last practical tip from the TLC resource.
The fourth tip is about improving our own process, evaluating the assessments themselves.
Reflecting on our own work as educators.
Yes. Build it in a way to regularly check, are these assessments actually doing what we intend? Are they measuring the right competencies effectively?
Are they giving useful information?
Useful information for the students, absolutely, but also for us. So we can tweak our teaching, adjust the assessments. It's not static.
Right. It's a cycle of improvement for the assessment process itself.
Exactly. Competency-based assessment needs that ongoing refinement.
That's really good advice. It's great the TLC emphasizes that. Now, I think the resource also mentions a few other places faculty could look for more information.
It does, yeah. For those who want to, dig even deeper, they point to things like the Competency-Based Education Toolkit from the Lumina Foundation and the Essentials Toolkit from the American Association of Colleges of Nursing.
ACN, right.
And also Margaret Rauschenberger's model from Alverno College on teaching, learning, assessment, and feedback. Just some examples of further reading.
Good to know there are other resources out there. So let's try to wrap this up. Thinking about everything the UTHSC Teaching and Learning Center resource covers, what are the main takeaways, the big benefits of this approach?
I'd say the core message from the TLC is that this allows for really meaningful evaluation, seeing what students can truly do.
Bridging that theory-practice gap we talked about?
Exactly. It hits that directly, which is so critical in health sciences. And ultimately, it's about fostering that continuous growth. Through having those clear competency definitions, using varied and accurate ways to assess them, and providing that consistent, really actionable feedback.
It definitely sounds like a powerful approach, and it's fantastic that the UTHSC Teaching and Learning Center offers these kinds of resources to support faculty here.
Absolutely.
Yeah.
It's a really valuable asset for all of us teaching here at UTHSC. We definitely encourage you to check out what the TLC offers.
Well, we hope this deep dive, drawing on that great TLC resource, gave you some useful things to think about regarding competency-based assessment.
Yeah, hopefully some practical insights.
Please join us again for another deep dive where we'll explore more resources and topics relevant to health sciences education. And maybe, just as a final thought to take away from today, consider this. What's maybe one small step, one practical thing you could try in one of your courses soon to bring in an element of this competency-focused assessment, something to mull over?